All right, guys, Tattoo Doc here. Welcome back to another episode of Rad Talk. In this episode, we talk about Ultrasound Awareness Month, Rad Tech Week, all that kind of stuff. We also talk about how many times is too many times to take your certifying exam or your boards for whatever specialty you're in. And then lastly, we answer the question of the day as usual. If you like the content, please like, comment, and subscribe to help grow the channel.
We're going to talk about some awareness.
A cause that's very near and dear to Dennis's heart.
That's right. So we're going to go into awareness for ultrasound. So ultrasound is kind of unique amongst the radiology spectrum that I've learned that ultrasound, we have a whole month of awareness.
There it is. Yeah.
Funny thing about it, though, is nobody really knows that we should be aware of it. So in all of radiology, they have X-ray week, they have nuclear medicine week, and ultrasound's the only one that has a month, but no one really cares that much about how making aware of ultrasound. And so the big one that usually gets celebrated is X-ray week or radiology week. And that usually consists of, from what I've seen, is the radiologists get together. The group will maybe like each day will have like a certain set of food or treats that they'll bring in,
Yeah.
or if the hospital, which is I think is a rarity, that the hospital kind of gets behind it and they'll bring in foods or treats. I think it's usually that the radiologist group buys whatever.
We spend our own money for sure.
Yeah, you spend a little bit of money to say like, thank you guys for your work, and like we appreciate you. And although we normally bug you guys, this is our 1 week or whatever. But and I kind of an aside with the nurses. So the nurses get a week as well. And I think it's in May. It deals with Florence Nightingale's birthday, I believe, is around when that happens. And so the nurses are, they're always constantly feel like as working outside of nursing, I feel like the nurses get a lot of praise. Whereas in radiology, ultrasound, we kind of get pushed on the back burner. And so it's nice that we're given a month, although I don't think it's truly as celebrated as is the month it is. And I think it was really just based off of Ultrasound Awareness Month, was just based off of the machines and being aware that like these ultrasound machines exist and that we do these exams and things like that.
You think they gave you a whole month for the machines? Not even the people?
I really think so. I think it was just for the machines. When I could,
how's that feel?
With the whole AI thing, it kind of makes you feel, whatever.
Don't worry. People think we're going to be replaced by machines too, so we'll be
for
on
sure
the same page.
Yeah, so I think there's a nuclear medicine week, which is kind of cool to celebrate, to have this episode today or now, because Ultrasound Awareness Month is in October, and so the month is now that we're being aware of that. And also, I believe it's nuclear medicine is also in the month of October, and then November 8th is the discovery. It has to deal with the discovery of X-ray, and that's when X-ray or radiology week starts, which everything.
Oh, Willy Ronkin.
That's exact. Yeah, Wilhelm.
You know how twisted that dude was?
I do not.
Who do you think he X-rayed first when he discovered X-rays?
His wife.
Yeah, kept a ring on it, just fried her hand. Obviously, they had no idea that they were doing that, but you should see. I don't know if it was his or hers. One of their hands at the end is just mangled. Right. It's fried. Yeah, I think he got osteosarcoma because he was just radiating his hand. Right. Obviously, they're in the beam. They're right in the beam. They have no idea. Right. Just like the what were they? I don't know what they were called, but they were the shoe shiners. Or no, not shoe shiners. You could you could try the shoe on, and it would X-ray your foot, so you could see how much like room you had. But I mean, they were staring in the beam when they did that, so they're just getting roasted.
Oh my gosh!
So needless to say, X-rays come a long way since then.
Well, and I think he died of cancer, right? Like you said, I think
I think it was osteosarcoma. Don't quote me on that.
Which makes sense. I mean, it doesn't make sense, but like he's so excited that he like created or founded this thing, and he's just like, oh, I just want to do it over and over again. They're like, oh, we can make the perfect shoe size fit your foot, and like whatever it is, and when you're
he didn't even get to live to see. I mean, what he discovered and what we do now are just totally different. It's the same concept, but they're just totally different. I mean, obviously he didn't get to see CT. So, but yeah, I mean, he changed medicine. I'm not sure that was his plan,
Yeah.
but he changed medicine.
Well,
So
and even I think the first ultrasound was done in a bath, or some sort of tub or something. And so all these people that, these very smart people that come up with random things. Um,
you know,
what's that?
it's innovation.
Innovation. Yeah. AI. We're moving forward.
Yeah.
um,
So since it
mhm,
is Ultrasound Awareness Month, I need
right.
2 pros and 2 cons of being a ultrasound tech.
Okay. So I think we'll start with the good stuff. And so the pros of being a sonographer, you get to you really like like a Sherlock. You're like a Sherlock Holmes. You're in there kind of trying to figure out what is going on. So if you see, some sort of fluid in a certain area, you're like, okay, could that be in Morrison's pouch or a different spot of fluid as well? And so like you're the eyes and the ears of the eyes of the radiologist, excuse me, the eyes of the and ears, I guess, because you're asking the patient's questions as well. And so you're the eyes and the ears of the radiologist. And so you have the opportunity to kind of like investigate and find out more details and then go back and report it to you guys and allow you guys to make your dictations. And so I think that's a really cool aspect that, you're not just a glorified button pusher as
Yeah.
as some people are think that you are. Like you're really in there and you're like thinking about, okay, what is this? What is this? What is this? And I'm sure
Yeah.
there's some sonographers out there that kind of just go through the process or whatever. But you have the opportunity to like think outside the box and say, well, have you had cancer in the past? Or like just ask them different questions to make you maybe lead one way or the other. And then
Mhm.
all of the different things you can ultrasound, I think if you're an echo or if you're an OBGYN
Yeah.
or if you're in general or vascular. And so there's all these different, or, Gage's favorite, musculoskeletal.
Yeah. God.
And so there's these different things that you can ultrasound as well. And so you're not just like stuck in
Yeah.
one particular thing, which is really cool. Um,
Yeah, we've talked on the past before, but ultrasound is definitely the most user dependent. So you guys
for
definitely have the most freedom to do, whatever you
right.
want to do. So we rely very heavily for
Mm,
interpretation on you guys because if you don't get the images,
right.
we can't see it.
With great
So
power, with what is that quote? With great power comes great
yeah,
responsibility. And so
yeah,
you,
yeah.
you if you have a good sonographer, bad sonographer, indifferent, you can it makes a world of difference on who's doing your exam, um, with the amount of experience and knowledge and things like that. And so whereas other jobs, maybe you don't need that same level of expertise
Yeah.
that you would want somebody to have if they were doing your shoulder to look for a tear or whatever, different things like that. And so that goes a long way. And so I think those are some good pros of ultrasound. And
Now give me the cons.
with every good comes bad. And so the cons are obviously, I think that, and I don't know if these stats have changed, but when I was in school, they'd always said that the average sonographer's career is about 20 years. And then usually you're done because you need shoulder surgery. And so
Yeah.
you get accustomed to pushing
Throw
on usually,
throw out your rotator cuff.
yeah, it's gone. Literally 20 years and you're gone.
Yeah.
And that's because you're pushing on pregnant women. You're pushing on a
Fat people.
population of fat
Yeah.
people that
Yeah.
exist in the United States. And so that same constant motion and then reaching, and I know patients, I think as a patient, you wouldn't think about it, but if I'm reaching across your body and then pushing any,
Yeah.
the further away from my body I get, and then the continuing to push adds even more stress on that rotator cuff.
I've never asked, but do you use the same arm or do you switch?
And so I use the same arm predominantly
Yeah.
unless there's like certain exams that I'll switch to. And honestly, I would like to. It's tough because you have a certain speed, and then to switch
Hmm.
that, it would take me time.
Yeah. And then
I don't have the
administration is
muscle.
going to get pissed because, it took you 40 minutes to do a 20-minute exam. Yeah, that
Right.
makes
It'd
sense.
be, it'd be like if you're reading something and you're like you read an exam and all of a sudden you go from 5-minute reads to 20-minute reads and they're like,
Yeah.
what's going on? We need you to read faster and more. Like,
Try to read that one blind, guys.
yeah, exactly. And so, and I always give it, whenever I'm coming up to do an exam, the nurse will say, well, can you just do it on this side right here? And I say, if I give you a pen in the rest of the day and I say, write with your other hand and be just as good as the other one, like, how are you going to do?
Yeah.
And
Take
so
that,
they're
bitch. That's the most passive aggressive shit I think I've ever heard in my life.
and
If
so
I give you a pen, can you write in the opposite hand? Wow. You
yeah,
actually say that to them?
I do.
Oh,
I'm not even kidding with you. Yeah, like, and
wow.
looking back, maybe that was like a mean thing, but I
That's an
was the only
HR
thing
nightmare right there.
that was the only example like I could come up with in my mind to like help them understand like why. I guess I could have just said no, I can't.
How did she take that?
But and I've done it with a lot of people, and
Oh
so
man, he's a
I've
repeat
done it
offender. Jesus
multiple times,
Christ.
and maybe that's something now that you're bringing this to my attention. Maybe that's something that I probably should not do anymore.
No, I mean they get the point.
But like that was the biggest. I was like trying to, certain folks are like, oh, okay, like yeah, that makes sense. And then some of them, I guess, take it the way that you would have taken it. Like
Yeah,
I'm trying to backhand jab you,
yeah.
when like my mind is like just trying to explain to you like why, because I try to understand like why. And so I'm like, this is the reason why I can't do it on that side. And so yeah, I probably maybe I don't know. I like my explanation. I like that. So, but
Okay, so
yeah,
there's one. Give me one more. So you have
another
injury. What's another one?
I think call.
Oh
I,
yeah, yeah, yeah.
I think having to,
We've been on this topic before.
yeah, work
Some of your
all hours.
colleagues are not happy about some of the exams they have to do for call.
Right. Yeah, that's true.
Yeah,
Well, some
yeah,
of the exams and then being on call in general is just not a fun thing. I think another pro, even just to kind of jump over there, would be like obviously I've had the opportunity to travel all over the world and do this too. So that's like a cool pro that you can travel and make money and have a good
yeah.
career. And but the con would definitely be
I
the
heard that
shoulder.
California's hiring if you're looking. So
Right now, California, Oregon, right
yeah,
now, hardcore. Yeah, some. If you look at our last episode, the old strike is looks like it's rearing its head again, and so lots of places are hiring again.
yeah.
But yeah, I think those are the biggest ones, and especially the surgeries. That's it would ergonomically. I think if as another sonographer, if I would tell them anything, like know your ergonomics the best you can. Tell your patients to scoot closer to you. Sometimes I tell my patients like, I need you to scoot like a lot closer to
I
me,
mean,
and sometimes
get
it's
up
like,
in you. Yeah,
yeah, sometimes it's inches. I'm
yeah.
telling you to scoot a couple inches or centimeter, whatever it is, and they're like, okay, and like they'll just scoot, a little bit close, and then I tell my patients too, like, so doing the same consecutive motion causes me to kind of um, have to maybe like have shoulder surgery in 20 years, and so the closer you can get to me, what is it, abduction, where
That's
it's
a
like,
way.
yeah, way. So yeah, the further the abduction my arm gets from my body, the more likely I am to have an injury. And so I want to adduct them closer to me, if I'm saying that correctly. And,
Just bring.
but
Yeah, yeah. I get what you're saying. Yeah.
yeah, well, I mean, I don't know. You're the doctor, so you tell me. Um, but yeah, I think those are probably the biggest cons is
Do you
call,
think
and
your colleagues would agree?
I think so. I think call, especially
The
the
injury
old
one I've heard a lot of. I think that's pretty common.
the older folks, especially because people who are usually people who are younger start out and they try to take the call because you get a certain rate whether you get called in or not. And then if you do get called in, especially if you live close to the hospital, then it's some fast money.
Yeah.
But especially
Cash
because of
rules
exams,
everything around me, huh?
yeah. Especially because if you get called in, you can get an exam done in 10 minutes and you get paid, your 2 hours at time and a half or whatever that is. And so that's some quick money that you can make. But if you're living further away from the hospital and it's, a weekend or something, and you're just like, you have
Yeah.
a family and it's just taking a lot of time away. And so it's just, especially you get older, that I think the older folks who have been doing it for a while are just like, I would rather not. So I think
Yeah.
injuries and call are two things that people would tell you like sucks. And now you're gonna see other things too that people are like have preferences on exams. They're like, I hate doing,
Hmm.
OB, or I hate whatever it is.
Yeah.
Just like in your field, they don't, I don't want to read that. Like that's
Oh
not
yeah.
something I've read a
Fuck.
lot of or whatever. And so I
So
think
now let's get some. Give me one pro and con of
mhm,
having to interact with us.
I
I'm
think I
sure.
told,
I'm sure your colleagues could come up with a gazillion cons.
yeah,
Writes the
for sure.
report for them. Just puts in there what I can hear the shit already. So let's hear what you're. Let's start with the good first.
And so Gage has put me on the spot here because this was not talked
Yeah,
about before.
we didn't discuss this.
So a pro of having to deal with you guys, I think, is a pro is that you guys can teach us a ton of stuff, and so
Be
all
careful
of,
now. Your colleague's not going to like that.
yeah. Well, I think they would agree with me on that, because there's a lot of times that we'll go back and have a conversation with you guys, and you'll say like this and this and this, and you're like, oh, okay, like that makes sense. And so you guys help us get a better understanding of everything because of the anatomy that of the
Hmm.
that kind of stuff that we
Yeah,
might.
that's the part of ultrasound that you guys don't grasp, is that our anatomy is better because we see it on other scans, other MR, CT. So I know
Mhm,
way more, not way more, but I know more anatomy. I know non-ultrasound anatomy, which helps me
right.
with ultrasound.
And I think even like, something like if we're not used to seeing the ovary, or like, well, I don't know, something simple even, that we can go back and say, hey, like, where are you seeing this at here? And you're like, oh, their ovary sits really high. And
Yeah.
so you should be if you guys are looking at another CAT scan, you guys say, oh, the ovary's much higher. That's probably why you're not seeing on this exam, or the ovary's atrophic, or the pancreas is really atrophic. So you're not going to probably see it as well on your ultrasound. And so you guys can really help us with that. And even, other aspects that you guys learn in medical school that we're just not, that we don't know, and you guys can teach us a lot of stuff. So I think that's really cool when we go back and you say, well, did you try this, or did you do it this way? And you're like, oh, okay, I didn't know that. I had one radiologist that made me, I couldn't get gallbladder stones to roll,
Oh
and
God.
he wanted them stones to roll. And so he made me tell the patient to get on all four, like a dog, on the bed, and
Jesus
then
Christ.
made me scan this patient. And
That's where our reputation comes from. Just
I
call
was
them gallstones and move on.
I was blown away, because there was also, what the crazy part is there was a body marker on the machine for this position. And so I was like blown away, because I put the body marker of this individual like on all fours, like a dog, on this bed. And like that's how I had to do the scan to like
Do they have
last.
cholecystitis at least?
I don't know that they had I think it was just
Yes,
stones I just could
exactly.
not get
Jesus
to roll,
Christ.
and he was like, I need them to roll. And so I was like
No.
trying everything to make these stones roll. And
All right, now
I
get to the part that everybody wants to hear. Do
you
your
wanted to,
colleagues proud here and just
I
take a
think
fat dump on us.
the biggest I think the biggest con with working with you guys can be, yeah, that we feel like that
You write the report for us. Yep, I knew it.
we that we
I
write
knew
a
it.
big portion of the report, or we could write it,
Jesus
and you
Christ.
guys just copy and paste what we
Yeah.
say and put it in there, and we don't make what you guys would make, but
We've
yet,
talked about this before.
yeah, we have for sure. We
You
beat
don't
this
make
horse.
what we make
Right.
because you don't take the liability that we take. If you
Mhm.
think about it, I'm taking responsibility for pictures you took.
Right.
I had no say in these pictures unless you come to me and say, "Hey, is this enough?" Or
Right.
and then I tell you to go get some more.
Hmm.
So when you take the liability,
Hmm.
then your pay will go up.
Right.
And you have said this before.
Hmm.
You guys don't need us until you need us.
It's true.
When you're
Yeah.
not sure of something, you're like, shit, I better go tell the radiologist. And then if
Hmm.
I'm not sure, I can't say, oh, I don't know what it is. Like I have to take responsibility for it. And
Right.
so you guys, some radiologists, I will admit, they just write down whatever you say, which is dangerous because if you miss something, they just missed it or
Hmm.
misdiagnosed it, whatever.
Right.
So I was ready for that one. I knew that's where you were going to
Yeah.
go.
Well, and that's probably the biggest con, but I think that even, and I think that's not necessarily accurate, because yeah, we need you guys to be able to. We can't read anything else wise, and so we need you guys, for those reasons.
Yeah,
But
that's
yeah, and,
another issue. I know we've talked about you guys like signing your own reports before, but I don't
mhm,
think you would know what the next step is a lot of times.
right,
because your colleagues are not going to like this, but I was talking with an IR physician the other day, and he agrees. Like ultrasound's a screening exam essentially for a lot of things.
Yeah.
Sure, you can diagnose a DVT. There's things obviously you can diagnose.
Right.
But I was looking at a tips on an ultrasound, and the tech was saying there was no flow. And I'm like, is your probe at the right angle? Like, are you making it look like there's no flow? Yeah, whatever. So essentially, we had to get a CTA, of the liver.
Yeah.
So this ultrasound is a screening exam.
It is,
and you have to be able to know where to go next if the screening exam is positive. Like, what step do you go to next?
It's got its perks, with if you're looking for torsion in testicles, or if you're looking for different things like that, it can screen, breast. You use the mammo and then use the ultrasound for.
No, it has its uses
for sure. Everything has its use, and so, but I agree with you. I mean, sometimes you do get frustrated, and I've probably been there before when I feel like, okay, I'm just going to write this up and they're just going to copy exactly what it said, and it is what it is. Like it's all me. And I think that goes back to too, if the radiologists are jerks to you that day, or in general. Like, I think I told you I had a radiologist steal a pen from me once, and I was super upset about that. But that was another story. That I did a procedure. They took my pen and went back and said, "Oh, you took my pen on accident," and they got super mad because I was like coming for my pen, because we're just the simple sonographers, and every pen matters to us. So no pen left behind. Hashtag no pen
I think
left behind.
As far as egos go, you guys are lucky you work with us.
I count my blessings.
Like, imagine working for a surgeon full time.
Yeah.
You had your one horror story, a few episodes back, involved a surgeon.
That's true. That's true. Yeah.
I think as far as ego and like personality, radiologists are usually fairly laid back.
Yeah. Well,
Can you imagine if you, I mean, I won't say his name, but there was an attending at my residency. He was first or second year, like his second night of call. He's like, I had to go into the OR because the surgeon was doing something with the liver transplant or something, but he had to do like ultrasound on the liver, and he had to do it. The tech wasn't allowed to do it. And he's like, I've never done this before. And he fucked it up, and the surgeon got pissed. So it could always be worse. There are bigger egos in medicine than ours.
That's true. Well, and especially when you're outside your wheelhouse, you're like, I'm the rad, and I'm used to reading the exams, and now it'd be like even sending you guys, and I don't know, maybe you know better than me, sending you in to do the CT scan, or to do the chest X-ray, or to do you're like, well, this is not I don't take a chest X-ray every day. I don't do this liver ultrasound. And so
we know what it should look like, but we can't set it up and actually do it.
Right. And so, that's where the sonographer tech, whatever, comes into play. We each have our jobs, and we each complain about the other job. It's like the weather. Everybody complains the weather's whatever, wherever you're at. And his pros and cons.
So we'll start with the pro. I'll give you two pros. One, obvious answer: money. Radiologists make, even in medicine, we make a good amount of money compared to other doctors.
True.
But the life, we'll save that one. And then, so money is the first one for me. The second one, maybe even bigger, is that I don't have to see patients regularly. I don't do too many procedures where I'm at now, but obviously I did in fellowship and residency. But in the top three reasons I did radiology, patients was number one. Like, I didn't want to see them ever again. I think I've told this story. I was like 5-10 minutes into my first patient encounter as a third year, and I was like, I can't fucking do this. They're just drowning on about diabetes, and I'm just like, I cannot do this.
Yeah, it's not your
so
thing.
that eliminated everything except radiology and pathology. And I was like, I can't look at a slide. So so money and patients. And the third one isn't like anatomy. It's all anatomy based. Radiology is. And that was the only class that I thoroughly enjoyed in med school. Everything else was just like grinding, your nails on a chalkboard.
Grin and bear it.
But the cons, which
I can't.
Oh my God. So the first one is that we are a referral specialty, right? So we're essentially at the mercy of everyone else.
Mm-hmm.
And when you get outside of academics, where academics it's essentially a salary, right? You're paid the same for whatever you read. So you don't care if they order more or less. I mean, you care if they order more because you don't want to do it. But when you get into private practice, sometimes you get paid more if you read more. So when you're a referral service, everyone has to order the studies for you, right? You can't, sometimes we recommend studies, but we can't recommend our own studies like 99% of the time. So we're relying on other people to do it for us, which is fine until you get the current climate of medicine, which is nobody knows how to order imaging.
It's true.
I was talking to one of my partners who was on the overnight. He's doing overnights, and he's like, roughly, I would estimate that 60% of what I read last night was not indicated. Wow. So over half of what he read was not indicated, which means, and we're not of like a per click group, so we don't get paid more if we read more. Mm-hmm. So he essentially 60. If he read 100 studies, 60 of them he should not have read because they weren't indicated.
Right.
So you can imagine he just doubled his workload. One, he's working the overnight shift. Now he just doubled his workload for no reason.
Right.
So for me, it's the fact that we're referral based and people don't know how to order imaging. So we get dumped on. And in private practice, usually you don't say no because you don't want to piss these people off.
Because that's your referral.
Usually they don't have other options, but you still don't want to piss them off.
Yeah.
Because you need them to order the studies. And if you're at a place where you get paid more to read more, you're like, okay, fine. I'll read, a normal chest. I'll read 65 normal chest x-rays, even though they weren't indicated, because I'm going to get paid more for this. But so that's one of my biggest pet peeves.
Yeah. I think that's a big con is, and I think if I was in your shoes, I'd get super frustrated with they order an exam and then you read the exam and then you recommend the next step. And I see so many times because I'm reviewing images from the ultrasound. I'm like, okay, I'm looking for a CT. I'm looking for whatever that maybe they've recommended as the next step, like follow up with this, and they never have it. And so they never get that extra order for that MRI that they should have got, or that CTA, or that whatever else was the next. Like you said, ultrasound being the initial, maybe the screening exam, and they should have gotten this, and it just never comes. And you're like, but they ordered some other random study that has nothing to do with what you recommended. And so I don't really understand why, I guess, but that would be very frustrating, is like wanting to read the next step that they should have and they don't have it. And so I think that just goes back to the disconnect of the ordering providers or physicians and the radiologist and their lack of maybe wanting to reach out to you guys to ask like what next, or following what you guys say, or just better communication avenues that probably need to somehow happen in this wonderful world of medicine.
Yeah, I know we've talked about that before too, in terms of, I tell every like medical student or resident that's not radiology, like if you have a question, just call.
Right.
I'm be more pissed off if I have to read an exam that is not indicated than I would be if you called me to ask if the test is indicated.
Right.
So just call me and ask.
I'll always call, for sure. You get enough phone calls as this. What's one extra call to get something correct? I agree. And so yeah, I totally understand your pros and your cons there. I think so I guess we could move past that, I suppose, and go on. Let's go on to our next part here. And so this is a question that we saw on either Facebook, some social media page. And on the social media page, it basically said that they had failed an exam, I don't know, 5 times or something. And it was just like, how many times is too many times? And when do you maybe either hang it up and go do something else, or do you just keep taking it until you can till you pass it? And because I know the difference being in, I think I unless it's changed, I think in sonography, I think you can take it, you pay the $275, you have to take 60 days off after each test.
Cash money.
Yeah, exactly. Cash money. So they continue to just kind of, you want to keep paying us and keep failing, like just keep paying
Yeah.
us, keep failing. And
What did you clarify which exam it was? Because I think it's related to, it's probably one you've taken before, I
yeah, I
think.
think so. I believe it was in the abdomen or something. And
Okay.
I
Yeah.
know there's certain stats for like, I think the vascular is more one of the highly or failed exams, like the pass
Mm,
rates 40%. I don't know what,
hmm.
each exam has a higher, lower pass rate. And so, and it
Yeah.
changes year to year. And
Yeah.
so I
But
think this is,
I think you have since you've passed it, I assume you passed on your first try. You don't have to tell anyone, but you have the perspective of like,
mhm,
the exam they're taking, how
mhm,
hard it is, how not hard it
mhm.
is, whatever.
Yeah.
So they've taken it, you said 5 times.
I think it was 5 times,
So
and they
put yourself in those shoes.
mhm.
You fail it 5 times. You get the fifth mm, email back that says you failed. What are you doing?
You get instantaneous, they tell you that day. They're like, it's
Oh, even better.
so you're in the testing center, or I assume at this point, you're probably, you can take it from
At
home
home.
too. Yeah, so you're taking your test at
So
home.
as soon as you hit submit on that last question,
You hit well, and I did them. I'm a little older, so I did it in the testing center. And
yeah,
so when I hit submit, it says go to your proctor or whatever. Like you have to hand it because they give you like a whiteboard that you want
yeah,
to write your
yeah, yeah,
notes
yeah.
on. And so you give them your whiteboard back, and they print you out the paper right there, and it says
God
like,
damn, the proctor sees it too.
yep.
Oh,
And I can remember when I passed, the proctor like prints it out, and I don't know if they know where to look or whatever. They print it out, and it's got the picture because they take initial picture of you,
hmm,
and so it's got the picture and it's got your score. It's got the passing, like what the passing curve is, and it says pass or fail, and they like hand it to you, and it's so yeah,
yeah,
you get it right as soon as you're done. You find out it's not like the NCLEX with the nurses where they have to wait a month, or with your testing with you guys where you got to wait whatever period of time it is. As soon as you get, and so if you fail, you have 60 days to
God damn,
then
you have to wait 60 days.
before you can retake it.
Jeez, did they
They
tell you how
won't.
much you failed by? Like how many questions?
Nope. And
No.
that's one of the crazier parts too. Is so I think the cutoff, I think it's a 555 is the score you have to get, whatever that means.
Yeah,
There's 170 questions, and I assume they weigh the questions
yeah,
differently, however they choose to weigh it. And I was told, I don't know the validity of that. I was told that certain questions don't even count, and so they're just like practice
yeah.
questions. They're
I've
trying
heard
to
that before too.
that they want to like see how
They'll use them
people
on
do.
future exams
Yeah,
if they're
future
good.
exams
Yeah,
or whatever it is. And so certain ones don't count, and then you have certain ones that count a lot more. And so somehow you get to this random number.
so you have to
Of,
hope that you miss the questions that don't count and get the questions right that count a
yeah,
lot.
just get them all right, right?
Yeah, but it's crazy though because that means it's predetermined.
Mhm,
The passing rate is predetermined, or the
mhm,
score is predetermined because they
mhm.
don't scale. They don't weigh it at all.
Yeah.
Like they don't like our exams. They say they don't do this, but they do.
Mhm,
You take it,
mhm,
they grade it, and then the people essentially that wrote it or that helped write the questions, they
mhm.
will let them look at the questions that were poorly scored.
So
So
like a
if people
curve.
that yeah, so that people that were doing really well, if they did bad on a question, they'll be like, "Oh, is this question trash?" And then maybe they throw it out. So
Mhm,
it's curved, right? It's not
mhm.
predetermined. They say it's not, but it is.
Yeah.
So yours is just straight up.
And
Yeah,
it's weird because you don't know what each question is worth, and they tell you like a generalized thing, 40% of the test is going to be on,
dog shit.
patient
Yeah,
care, whatever
yeah.
you're taking, whatever it is.
Stupid.
And so you're just like studying random everything to try to figure out what your test is going to, then you end up taking it, especially when it's interesting because like when you take the abdomen test. Abdomen has thyroid questions on it. It has testicle questions on it. It has your prostate questions on it. And so, like, it covers your abdominal ultrasound exam covers such a broad range of like
Yeah,
random freaking stuff. And then, how much is that prostate question worth versus how much the thyroid question was worth? And so, I don't know that anybody actually knows the answer to that question,
yeah.
but
So
but yeah, I
it's
think.
just a shit show.
Yeah, it really is,
Yeah.
and so, I mean, man, failing it 5 times though, like,
I mean,
that's
these things exist, I think, largely for money.
for
You
yeah,
know, I took for us, it's called the core exam. and I forget. I think it's $640 all 5 years that you're in residency
Mhm.
to pay for the exam.
Yeah.
So what is
Yeah.
that? 3,000 some odd dollars, 2,400 something like that.
Yeah.
Uh, so it's just a money grab. That's all it exists for.
Yeah.
You know, I have
Yeah.
to pay dues every year just for no reason.
Right.
Like
Right.
these exams, if it wasn't a money grab, if you failed, you would take it again for free. But the
Yep.
fact that it's like 275 or whatever you said every time, that means
Yeah.
that person's paid $1,000 to take that exam,
Yep.
and they're still not a sonographer.
Right. That's
So you
the
just got $1,000 from someone who's not going to be in your
Mhm.
club, you know?
And I'm curious too. So this is like a random aside. I don't think we didn't talk about this, but once you so now that we've passed, say you're passing your official, you're a sonographer or whatever. Now they're trying to create exams that you take to kind of continue your
Yeah, welcome to medicine, buddy.
like. And it's fine, like to do continuing education, but like
Yeah.
have you sit for another exam
Yeah.
to like make sure that you're still competent enough to do whatever it is. I was like, that seems like if another like I don't know 10 years from now they were like, you know what, we need you to retake that core exam again and do that, and you're like, like I passed, like can we move, like I'll continuing like studying and keep up on my stuff, but
Yeah.
like, you have to
So
repeat that again.
I'm sure some doctors still do have to take exams. Radiologists used to have to take exam every 10 years, just recertify, just like that.
Yeah.
Now we have other options, but you can still, I think you can still opt to take the test every 5 or 10 years or whatever it is. So it's still a possibility. So it's
So
not unheard of in medicine,
yeah.
for physicians to have to called recertify.
Yeah.
So, but no, you're not going to catch me doing that shit.
Well, and I
No.
thought and that's what we're what's interesting is our like credentialing body ARDMS is there. I believe they're the one that's like pushing for it, and it's just like
Of course they are.
it's like, so we pay you yearly dues, we pay you for each test, and
Yeah.
now you're the one who's pushing us to have to pay
Yeah.
you to recertify. Like this is
That's, I
some
mean, we pay the ACR, ABR, whoever it is,
yeah.
and they're supposed to go to DC to lobby for us.
Hmm.
Your reimbursement's still getting cut. What the fuck are we paying you for?
Yeah, paying you.
Reimbursement's been cut every year for like 20 years. Like, where are dues going? You're just
Yeah,
stuffing it in your pocket, I think.
that's probably what's happening. The lobbyists are lobbying and they're saying, "Thank you for your money. Pay me next
Yeah.
year." And so, yeah, it's and you know, and I don't know that. I guess we brought that up. We really don't. You don't know the answer to the question. You know, maybe on the sixth time they'll pass, and then everything in the past didn't matter. And so, but you know, sometimes I guess if you get to the point and you decide that maybe it's not for you after that fifth time or sixth time or seventh, whatever, you know, then you move along. But it's your life to live however you want.
Yeah,
But I
I'm gonna be
think
real with you. 5 times, you got to call it a day. Like, you have to call. I mean, right? The only time you fail is if you quit, but you got to quit at this point. Because like, at what point then do you like question, like, do they actually know what the hell they're doing? You failed it 5 times.
yeah, and maybe they need to get back to I don't know, they study different things. There's so much material out there that you can get your hands on to kind of help you. You know, oh, you got the ultrasound registry review. If this is sonography related, obviously, you got the registry review. You got Edelman's courses, the X Zone, which I think are awesome. Penny, just to name some different like authors that if you aren't in looking at these ones, I think this is your bread and butter. That if you know this stuff, you're gonna pass the test. But yeah, like Gage said, that's tough. And
I just
so
gave some free advertising there for
I know, yeah,
whoever those people are.
yeah,
So
yeah. If it's like one of those things, if you know, you know, like that's not even like
yeah,
that. Everybody knows those folks. If you're in this field, you know the folks. And so, all right. And so I think we kind of went
all
over
right,
that
last
one.
part here. You get to do this. This thing the second time in a row you've come up with the question. Little
I know you really
current
let me.
events, themed question
Mhm.
of the day.
Yeah. So I think it's kind of crazy. Gage is kind of his favorite thing in the world is having this question. He's letting me do it again, which is cool. And so
Yeah.
I think we were gonna go with, since it's almost Halloween, what is the best or a cool Halloween costume that
Yeah.
that you'd like to wear or that you've worn before? And if
I
you
mean,
just before
go
you
ahead.
get started, a brief
Yeah.
plug. We also came up with uh, a good Halloween costume for a radiologist, a sonographer. I think I even did maybe a CAT scan, folks, and I think they're hilarious if you haven't had a chance to look at them. But if you haven't, please.
Where can I find them?
Oh, if you go to rad_talk_DG, you can check out all our social media handles,
That's
and
right.
and you can see all those wonderful pictures of Halloween costumes.
All right. So, I mean, if you watch the video, you could take one look at me and guess that I don't dress up for Halloween. So,
Yeah.
I have blacked out my childhood, I guess. I don't remember ever dressing up for Halloween,
Mhm.
maybe except one time. And I don't even remember if it was for Halloween, but it was the white Power
Mhm.
Ranger.
Yeah.
I think I had the helmet, I had the gloves, I had the suit.
Mhm.
So I don't know why I chose white because the pink,
Well,
what's her name? I forget the name, but
Kimberly.
yeah, she was
Mhm.
like when you're a young man and you first lay eyes on her, you're like, oh yeah,
Yeah. Well,
her
well,
and
mhm.
Topanga. Those were
uh,
the two. You know, you grew up in
oh
our
yeah,
era. Yeah,
Boy Meets World. Yep, Boy Meets World.
yeah.
Yeah, yeah,
So I
um,
think I think that's the only time I've ever dressed up for Halloween.
yeah.
If
Well,
I,
it was a good costume choice. The White Ranger was one of the best,
yeah, it's
and so
iconic.
yeah, for sure.
You see my
Definitely.
chubby little ass out there door to door. I got
I
a
gotta,
I got a pumpkin, you know,
yeah, for
asking
sure.
people for candy.
That's exactly right.
It's an
Everybody out.
obese, it's an obese white Power Ranger asking for
Right,
candy.
right. I wonder.
Halloween is twisted. You're just
I
out
wonder.
there knocking on strangers' doors asking for candy.
Yeah, that's kind of
Jesus.
interesting. I wonder if the kids still use the pumpkins. Like I know we used pillowcases, and I think I had a pumpkin at
Yeah.
one point as
I
well.
remember one lady like right down the street from my house was giving out sodas. And I was like, "Oh yeah, that's my house, right?"
That's when
Of
the
course, it's
Dr.
like the
Pepper.
knockoff fucking Dr.
Uh,
Thunder. And I'm like, "Come on, lady." Oh my god.
that's funny, the Dr. Thunder, and that's where the Dr. Pepper obsession began.
Yeah, I chose the real. Come
Yeah,
on.
it's like
Jesus
you always know the people that give out the full candy bars, and so you
Yeah,
go
those
to
are your favorite.
those are your favorites. I think, so
I know you
I
dress up every year. You probably still dress up. So let's
uh,
hear the
okay, so I'd say the best one I ever had was I dressed up as I think it was the Lucky Charm leprechaun.
Oh my god.
And let me tell you this, and I don't think I've ever told you this. And so I dressed up, and this was when I was working for I can't remember some hospital. Is before I graduated college. I may have been in college, dressed up as this,
Oh,
and they
yeah.
had the hospital had a costume contest. And so I
Yeah.
dressed up and entered this costume contest. We had whole departments that entered this costume contest. I did like this crazy jump in the air. The lady took like the perfect photo, and this is before like the camera phones were really popular, and so like you couldn't just take a bunch of like she had to time the photo
Yeah, yeah.
correct. Like, and I had to jump. Like she did it perfectly. I timed the jump. It was great, and so I end up and I'm entered in the contest. I'm like, whatever it is, what it is. Well, I actually won a Halloween costume contest. I can't remember what I got at this point. It was something. I can't remember what it was,
You were
but
in college at the time?
I was in college. Yeah, yeah. I
Did
was
you
in
go to a
college.
party that night?
Probably. Yeah,
Oh
probably.
man, I know you missed a golden opportunity.
Yeah.
All you had to do was put a sign over your pecker that said magically delicious and it would oh my god. Can you
Okay. This is
wow.
I was it was not that type of
I know.
you know.
That's a if you're in college, you're welcome for
For that,
just yeah, if kids
he's
listen
given,
to this,
you
yeah,
know,
that's free. They're oh my god, they're getting so lucky this weekend. Wow. That was too good not to share.
but yeah, I won the costume contest. You do whatever, whatever you want to do with Gage, whatever piece of information Gage just gave
Yeah.
away. You
That's
guys do whatever you want with
golden.
that.
That's golden.
It's gold. Magic, what was it? Magically delicious.
Magically delicious. That's his phrase, right? And Lucky
Right. Yeah,
Charms,
no,
magically delicious.
well, it was crazy. I actually had the heart stars, horseshoes, the
No, of course he
clover
went with the childish tune instead of
and blue
oh
moons.
my god.
It had like a little like attachment to it that you like held on, and it had each one of the whatever those things are, whatever. I don't know.
God
I don't eat the Lucky Charms, but unless they sponsor me then. But
I mean, if they want me to do that, yeah, that's
I would
wow.
definitely think about it.
That may be
But
the
yeah,
best thing I've ever said on here.
that was quite a tip.
I'm gonna clip that, and that's going on. That's going on TikTok for sure.
That's cool, for sure. But I think that covers everything. Somehow we got.
I mean, I can't think of a better way to end it. All right, guys, that'll do it for another episode of Rad Talk. Hopefully you enjoyed today's episode. If you did, make sure to like, comment, and subscribe, and we'll see you in the next one.